Let's go ahead and jump into the content related to our snapshot for this session, taking a look at the 4 key steps associated with the exam blueprint. First of all, understanding what the purpose is of an exam blueprint and what should be included, and then mapping or alignment with the learning objectives. What does that mean, and what specific indicators do we want to look at when we're thinking about that process? The 4-step process that we want to talk about, and this is again supported by references that we have recommended to you all as part of your journey. Number 1 is to identify the specific student learning outcomes to be measured. Thinking about the content that we are integrating into our teaching strategies and helping students with the transference of knowledge that we want them to comprehend, what are those specific objectives that we want students to achieve, and what do those outcomes look like when we are able to validate that learning has happened? With the blueprint, what we're specifically looking at is going to be the cognitive domain primarily. There are certainly affective measures that you can put in an exam question, as well as psychomotor elements. But for purposes of this snapshot and an exam blueprint, we are specifically talking about the levels of cognitive learning. So that's the second step. There's a leveling process that we should engage in to ensure that there's alignment and that it is mapped back, number 1, to the level of Bloom's taxonomy, the cognitive domain. And then number 2 is going to be ensuring that the assignments as well as the course objectives are also aligned. So number 3 is going to be aligning those assignments specifically. We want to make sure that the assignments are appropriate for the level of the student that we're teaching, as well as for number 2, the appropriate Bloom's category that we're taking a look at. And this will make a lot more sense when we get to our next slide that's going to look at an actual example. And the 4th step is the percentage of questions that are going to be assigned to the specific Bloom category and also the specific objective. And then the type of questions. It's going to depend on whether or not you are completing a simple test blueprint or the more comprehensive test blueprint. Are you familiar with those? If you're not, just stay tuned. We're going to talk about the differences between those two as well. This is an example of an exam blueprint. This is a combination between simple and comprehensive. It doesn't include some of the comprehensive elements that we'll talk about shortly. So let's go ahead and take a look at this example. So you see here at the top, we have the cognitive level, and then we have objectives 1, 2, and 3. On the left-hand side is going to be a list of all of the 6 cognitive levels. Again, this is based on Bloom's taxonomy and the theory associated with learning. We have knowledge, which we know is the lowest level. The specific verbs that are listed here are list, define, and select. I have described here with an asterisk for 2 reasons. Number 1, I don't want you all to get confused, but you will see describe show up depending on the textbook that you're using and the reference that you're citing. You could see describe show up under knowledge, or it could also show up under comprehension or understand. But don't let that confuse you. The message here really is number 2. Knowing that it may show up as a verb for either one, it just indicates to you that that is a lower level learning area for evaluation of knowledge, right? Because you have the lowest levels being comprehension and knowledge, and then the highest level being synthesis. So you see here, again, I have listed out some example of verbs associated with each level. So that is step number 1 that I want to review with you all. The second element I want to review and call to your attention is you're going to see the percentage of test items that align or map back to the level of knowledge and also the level of the objective at the top. So 35% of the questions, and this is a 100 question exam, are going to map back or be aligned with the level of knowledge, and it's going to meet objective number 1. So this is an example of what an objective may look like: to recall basic pharmacology facts regarding medication or medicating children. So that is the objective. Remember that we want to make sure we are developing student-centered or learner-centered objectives. It should not be a teacher-centered objective, because we want to ensure learning has happened. It's not about what we teach, it's about what our students learn. An assignment example could be writing medication cards where we ask them to list categories of antihypertensive or list types of antihypertensives. We could also incorporate a Quizlet that asks students to define, select the list of medications and to match them. Okay, so that's just one example of an assignment. Objective 2, this is an example for the level of knowledge, would be identify medications for treating cardiac conditions. So let's keep going, taking a look at the next level, which is comprehension or understanding. Classify, calculate, interpret, and summarize are just some of the verbs that may be included in that category. I want to bring to your attention chapter 10 in Billings and Halstead, Teaching and Nursing. That's where you're going to find some additional verbs associated with each levels of Bloom's taxonomy. Again, I know sometimes nurse educators can get a little confused if the exact verb doesn't show up on the exam question. Just have a good understanding using your resources of the examples of verbs that may be at that level, and understand the examples of assignments as well as objectives for that specific level. Okay, so here we have describe treatment plans to manage signs and symptoms of congestive heart failure. And another objective for comprehension and understanding would be determine in which situations it would be most important to administer Narcan. An assignment could be a matching game with medication calculations, or writing medication cards where students are asked to summarize side effects. You see here application, some verb examples are solve, apply, relate, analysis, compare, differentiate. An objective could be compare the differences between beta blockers and calcium channel blockers. Evaluation could be critique and assess. Those are verbs that would be at that level. An example is conclude why the IV route is best for midazolam or Versed. And then synthesis, that's the highest level of learning. Verbs such as design, create, and develop may show up in the learning objectives or an assignment related to that level. And one example would be develop a research proposal on current evidence for removing Foley catheter to decrease infection rates. So a couple of takeaways I want you to process from this exam blueprint. First, just remember the 4 steps that are involved. And secondly, when should we complete the exam blueprint? Before or after the exam? If you guess before the exam, you are correct. So the exam blueprint should be completed as step number 1. That's why it's so important for us to identify the specific student learning outcomes that we want to measure. Sometimes what we see our colleagues do is backwards. We see colleagues that develop an exam and then we go back and do the mapping, but it actually should occur. The exam blueprint should be developed before the exam is even written, okay? Because this blueprint is exactly what it says. It's a map, it's a guideline for us as we move forward in developing our test questions. It's a whole lot easier to develop an exam when you have a blueprint to work from. It's like building a house, right? We would not build a house without a blueprint. We should have the same mindset about an exam blueprint. So what should be included? We've talked about those key elements. And what is the purpose again? Hopefully you have a good understanding, but if not, let's just recap the best practices. Is to, first of all, develop that blueprint through, is seen as a way for us to confirm that the exam is going to test the knowledge that we intend for students to have learned. And we have those quantified learning experiences as listed out in our learning outcomes and our learning objectives for that specific course. The types of blueprint, one example is going to be simple. The other one is going to be comprehensive. Billings and Halstead has excellent examples in the textbook. On table 25.1 is where you're going to find the simple example, and table 25.2 has listed out some elements of the comprehensive example. So the simple one, it's going to be a 2-way diagram. It's going to have the cognitive levels and it's going to have the objectives, just like the one that we previously looked at. And it is going to include the percentage of questions as well. But the comprehensive, it's based on the National Council of State Boards of Nursing, or NCSBN, that is more aligned with the NCLEX blueprint. This blueprint is going to include a whole lot more information than just the number of questions for each content area. What you saw in the example we looked at was the percentage. So this one specifies the number of questions for each content area. Okay, so when you head over to Billings and Halstead, it will make a whole lot more sense to you. It actually lists out a whole lot more information to include the concept, the level of the cognitive domain, but in addition to that, the type of question, whether it's a multiple response question or a single response, whether it's fill in the blank, a priority question, a matching question, as well as the client needs category and any related activity statement. So a comprehensive blueprint is going to have a whole lot more information. All right, I know this is somewhat of a lengthy snapshot, but I want you to keep going and be excited that you will check this off your list. Hopefully this resonates or connects with some of the content that you are already knowledgeable about. If not, go ahead and head over to 𝑑rSellarseducate.com. You're going to see a couple of resources that are easily available and accessible to you right now. First is going to be the membership. So this is a community of nurse educators. We come together once a month and we talk about key concept areas associated with the NLN Certified Nurse Educator exam. So we have a separate boot camp for the CNE and novice. So the novice, those of you that are on the journey to achieve your novice certification, you can head over to the CNE boot camp. And if you go to our website, you'll see it at the very top. You will click on membership or community and just click that button and you'll see how to join our group. I'm also going to include that in the instructions for this snapshot, so you can head over there and you will see those details as well in our description. The second reminder I want you all to be mindful of is the pass rate. So this is from 2020. We hope that we will see an increase in these numbers, but as of right now, what has been reported is that 69% of educators pass the CNE and 74% pass clinical. We want to increase that rate, and that is our mission here at Dr. Sellars Educate. And then the second important element that I want you to take with you is related to taking action. It can be overwhelming because there's so much content to review, and we are here to support you. We have divided the review recommendations to do two different levels. So level one is going to be for those nurse educators who have good experience, but perhaps there are large gap areas after you have completed your self-assessment. We encourage you to attend a live review. We have it monthly for CNE, and for CNE clinical, it's pretty much based on the demand that we're seeing. Our next one is in March because we've had several clinical nurse educators reach out to us. So that one will be happening in March. And also we have a novice live review, same thing, it's based on demand. For those of you who have just a few gap areas, but you want to make sure you do well the first time and are successful on the exam, we recommend what we call level 2. And we have a bundle as well on our website, so you can head over there and see in more detail exactly what's included in the bundle. But we recommend that you take a self-paced online review course. We do recommend our course, but any course that is aligned and supported with a framework by using the nurse educator competencies is an acceptable and one that you should certainly check out. But the benefit of the self-paced review course is that you're able to take a look at the content at your own pace, okay? And then you can supplement the review course with the weekly YouTube snapshots that you see here. And you'll have access to the course right away, and you'll see updates as well. We just refreshed our content for 2022 if you're watching this video in January of 2022. So that's a little bit about how you move forward, how you're going to take action, hopefully after today. We encourage you to write down the dates of the 3-step evaluation process that we've kind of talked about. Okay, so the first step, we recommend you do the self-assessment. So either purchasing the NLN self-assessment exam or using the candidate handbook or the practice test questions, just to kind of get a good sense of your gap areas so you can work on a plan to close those. What's your step 2 plan that is going to help you close the gaps using your resources? That's what step 2 is all about. So purchasing Billings and Halstead, Dr. 𝗂𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄𝗄 study workbook, and private coaching. So for level 1, that is what we recommend. And then if you are level 2, we don't specify years of experience because it really is about quality of experiences. How much involvement have you had with curriculum development and revision, as well as item analysis and looking at education theories and Bloom's taxonomy specifically. So if you find that you have large gap areas there, then we would recommend level 1. But if you have what we say is a medium level of proficiency in all of the competencies, and level 2 is probably a good place for you to plan for as it relates to the resources that you want to purchase and focus on. And then step 3, go ahead and schedule your exam. We recommend that 3 to 6 months as part of your study plan. So 3 to 4 months from now, depending on where you are on your journey, but within that time frame, we want you to go ahead and schedule to take the exam. 2022 is your year, and we hope that this has been helpful. That we will see you soon.